suggested COVID-19 is able to get into the brain. Impact may be direct or indirect. It can pass through blood-brain barrier, inflammation, or immune response, vascular connections, and some other mechanisms. Now, Alzheimer Association SARS-CoV-2 international research study to understand impact on the brain, investigating the long-term impact of exposure to the novel coronavirus on the brain, including cognition, behavior, and function. Early detection and diagnosis. First of all, we have brain imaging, which shows image of the brain. Then we have biofluid analysis, which is lab testing. Other than that, we have emerging markers, which show genes. Progress toward a blood test. Global race to uncover and develop blood-based biomarkers for Alzheimer's and other dementia. Most research validating amyloid beta and tau in blood by comparing to imaging and cognitive testing. New research on the blood test for alpha, synuclein, and neurofilament light and other markers. TAU and other blood biomarkers emerges, differentiate Alzheimer's from other dementias, diagnose stage of disease, identify inappropriate people for clinical trials, show changes 20 years before dementia symptoms arise. While still in research studies, blood tests are easier to administer and more accessible than current methods of evaluating Alzheimer's. Progress toward more effective drug treatments. First of all, landscape of clinical trials for Alzheimer's and dementia drugs and devices. First, we had to go through the phase 1, phase 2, and phase 3. Always a need for diverse participants. Now, here we can see Alzheimer's Association trial match. It is a free, easy to use clinical studies matching service for people living with dementia, caregivers, and healthy volunteers without dementia. Now, treatments being tested may benefit clinical symptoms of dementia or change disease progression. First of all, we have cognitive, which have memory, learning, thinking, and planning. On the other hand, we have behavioral and psychological, which include depression, anxiety, delusions, hallucinations, apathy, agitation, and sleep disturbances. Now, medicines focused on cognitive and functional symptoms of dementia. We have donanemab, which is an anti-amyloid therapy. This has the following cognitive properties. For example, cognition. Early symptomatic Alzheimer phase 2 trials show significant slowing of cognitive decline and daily function. Novel aspects of trial design must test positive on amyloid and tau PET. Volunteers switched to placebo once amyloid plaque level was lowered to normal levels. A second, larger phase 2 trial is still ongoing. Now, Biogen seek approval for aducanumab. Aducanumab, it is an anti-amyloid therapy which is a phase 3 trial population MCI due to Alzheimer's and mild Alzheimer's dementia. Futility analysis halted trial was held in March 2019. Expanded data analysis reported CTAD on December 2019, which shows a reduction in clinical decline, effects on cognition function, reduction in amyloid tau biomarkers. Changing the trajectory of Alzheimer's disease, delayed onset. If we develop a treatment by 2025, that delays the onset of Alzheimer by just 5 years. Introducing the Alzheimer Association Science Hub. Here we can find what we can do if we have an Alzheimer disease, what are the prevention, what are the precautions and medications or treatment we can adopt to get rid of Alzheimer's or dementia. In summary, Alzheimer Association is a global leader for Alzheimer and dementia science. Exciting time in research, new tools for detection and diagnosis, growing diversity of therapies under investigation. There is hope in research. If we talk about the vision, it is a world without Alzheimer disease and all of the dementia. Thank you so much for your time. That is all for today. See you in another video.